Good morning. Welcome to Men's Health Connected and this series on social connection and men's health. In today's session, we're going to be delving into some of the science behind social connection with two excellent speakers, Professor Adam Karg and Dr. Sean Martin. So I'd like to start by acknowledging the traditional owners of the lands where we meet from around Australia today. I'm joining you from the land of the Bailey, the Bunda, the Gureng in central Queensland. Please, as always, feel free to engage in the conversation using the chat box. You can find the chat at the bottom of the Zoom screen. If you just want to pop your details in there and say hello as well, so we know who's joining us. Share any information you want to about who you are and where you're from. It's a good way to get a sense of who's in the conversation. Just popping my details in there to role model good Zoom behavior. And if you've got any observations or questions as we're going along, do please pop them in the chat box. We'll be keeping an eye on those, and we'll try and make sure that they're included in the Q&A session after the talk. So it's been a really interesting series. Earlier this week, we had a really good delve into lots of different projects that are working to create stronger social connection in men. We've had a couple of talks on the basic facts and figures about why social connection is of interest in the world of men's health. And put simply, it won't surprise you to know that, generally speaking, social connection is good for our health, and lack of social connection or social isolation is broadly bad for our health. So we're really interested in social connection as a protective factor for men's health. But we haven't really had an opportunity in this series yet to actually delve into some of the science behind social connection. And so that's the focus of today's session. Coming up, we have Dr. Sean Martin, who's the program lead for the 10 to Men longitudinal study of Australian men. And a year or so ago, they did a report into social connection in Australian men based on that longitudinal study. So Sean will be sharing some of the findings from that report with us. But first, going out more broadly from men's health to someone who has a particular expertise in social connection, it's Associate Professor Adam Karg, who is director of the Swinburne Sport Innovation Research Group, who, put simply, and he'll explain it much better than me, have done a fantastic array of work on social connection, looking at frameworks and evaluation and all sorts of stuff that I don't understand, and I'm really looking forward to finding out about. So I thought that Adam would be a great person to give us a really solid grounding in our understanding of what social connection is. So over to you, Adam. Thanks for being here.
Fantastic. Thank you so much. I'll just ask that you can see the slides that I've just popped up there as we move through. Excellent. So we'll get started. So thank you very much for the opportunity, Glenn, to be involved and great to be part of this conversation with you. As Glenn mentioned, I am from a sport innovation research group, so I'll explain my path to social connection research as part of the introduction. But look, I will start by just acknowledging the traditional owners of the land on which we collectively gather today. And for Swinburne campuses and myself, that is the Wurundjeri people of the Kulin Nation, I pay my respects to the elders past, present and emerging. So today, as Glenn said, we've undertaken a range of different studies in social connection. We have it's a really nice time for us to, I guess, reflect on a presentation like this, because we're about to launch again a couple of other major stages of Australian Research Council grant work. So large projects are about to get underway, particularly in this space of social connection. So, and it's an exciting time for us to really bring together some of the work that we've done and talk about some of the frameworks and get some feedback on the frameworks and how they might transfer to industry and use as well. So from a science point of view, I am a social scientist. So I will talk mainly about the social infrastructure and the connection, but I will provide you with some frameworks, some research-driven frameworks over the course of today. We'll talk about some of the empirical studies that we've done, and I've got some indicators there to show you some of the how they're used, particularly in social connection. And also talk a little bit about measurement, and particularly the complexities of measurement and some of the things that we're working on in our current and emerging work. So yeah, focus very much on social infrastructure, on social connection today. We'll focus on some of the research frameworks. And as part of the end of the presentation, I'll just talk about two of our major projects, which are very much, in one case, ongoing, and one is about to start in the next couple of months. And they're big 3-year projects around these areas. So, as I said, really interested in any feedback and questions or involvement that you might like to have in some of those approaches too. Just as my background, and I think this is critical just to understand, I guess, my journey and why you'll see a particular focus on things like sport and leisure in what I'll show you today. So I am best known as a sport marketing or sport management researcher, and I'm an associate professor of marketing, but I do work in social connection as well. So my PhD was in sport management and sport marketing. Most of the partners that I work with are, to be honest, professional sport teams and national sport organisations, working on all sorts of aspects around understanding, to be honest, how fans and organisations connect and how communities of fans connect. How do we design services and products to really make sure that they are connecting, both from a commercial point of view, but also really to extract and make sure there's a social aspect to people's sport consumption. So a lot of our partners are, as I said, professional sport teams and organisations. That body of work has now started to incorporate, or I shouldn't say started for 6 or 7 years, has incorporated leisure and aquatic centres as well. But really across that sport and leisure context is where the majority of my work has been. I joined Swinburne about 5 or 6 years ago and had the opportunity about a year after joining to join our Social Innovation Research Institute. And since then, I've taken the program lead for a body of work around social connection. That's enabled me to still do some work in sport and social connection, but also work more closely with local governments and a range of other partners, including the Red Cross and NEMI, to look at social connection in a range of different contexts as well. So on the right-hand side there, you'll see, yes, I'm involved in some sport-specific work and publication and books around international sport business and aspects like that, and more than happy to talk to any of that work. But particularly with a focus today, things like social impact and social connection within the Leisure and Aquatic Centre, the infrastructure more broadly of social connection for local government organisations. We've now worked with, I think, 11 different councils in the Victorian region about the assets, social connection frameworks, and how that infrastructure can be maximised. And obviously a whole range of work around COVID and really understanding, I guess, the digital and hybrid opportunities for not only sport and leisure organisations, but also more broadly as well. So I bring here a lens most focused on sport and leisure, and you'll see that over the focus of the presentation, but we will obviously talk about connection more generally as well. I've talked through largely this already, but just to highlight a couple of the reports, all of this work is either or will be publicly available. On the left-hand side are 2 reports which I'll draw on in some of the slides today. One of those was with Royal Life Saving Australia, looking at the social impacts of that industry. One of those 5 impacts is social connection, so we'll look at that today. And on the left-hand side at the bottom is a major report working with 4 local government bodies or 4 local councils in Victoria and in inner Melbourne, looking at the infrastructure for social connection. Both of those reports are publicly available online. Happy to share the links to those in the notes afterwards. Let me know if you have any issues finding those, if there is interest. The 2 in the middle are 2 of my 3 major Australian Research Council grants. The first of those at the top looks at the outcomes, the community and wellbeing outcomes, including social connection of public, aquatic and recreation centres. And at the bottom is one of our projects, which I'll talk about at the very end, which is about to kick off, which is around social impact and community outcomes from community sport. So one particular context and how that infrastructure can be maximised. So again, they're just some of the projects which we undertake and that I'll draw on today. So the presentation for me is in 3 parts today. I'll talk firstly about social connection, secondly about the infrastructure for social connection, what we mean by that and some of our work in that space, and then thirdly, this idea of measurement in social connection and some of the examples, and to be honest, some of the complexity around that particular space as well. So in terms of social connection, as Glenn said to start with, we know it's a good thing. We know that, important that your social relationships and connection with people are important. And for me, they're important not only at an individual level, but also at a community and a national level as well. So we know that at an individual well-being level, people who are connected, that have better relationships, will report better individual well-being, better measures of connection, of belonging, of sense of security and sense of social support. So obviously at an individual level, connection is a great thing to have and a great thing to build. In addition, though, it's really important at a more aggregate level as well. So when we think about national or community levels, well-being is enhanced by having people who are well connected, who can generate, positive social values. Things like trust and reciprocity are great things to have in our community. And we know that the more people are connected and the better that they're connected and the more opportunities for connection give us an ability to really deliver on these at a community level as well. So we know at both individual and community level, significant opportunities. So important for individual and community well-being, and we know probably at a sort of from a physical health and a mental health and a social health perspective that people with fewer social connections are more likely to report negative health outcomes. So again, connection is a positive aspect to have. For our work and most of the work that I'll speak to today, we will talk about a strength-based approach to connection. So we understand that there's a lot of work around isolation and loneliness. We certainly understand that that has a clear relationship with connection. But for us, when we think about connection, we do take a pro-connection or a strength-based approach to a lot of our work. And that really allows us to focus on how do we build and leverage infrastructure, how do we talk about positive resources and mechanisms, and how do we create more opportunities to maximize the infrastructure that we have. So that strength-based approach, thinking about connection and using the terminology of connection or connectedness, is something that in our work we're more focused on than perhaps some of the other approaches. Just on the right-hand side, I think, specific to men's health, this was an article which was published in the paper on the weekend, just on Saturday in The Age. It was titled Mr. Invisible. It came in, I think, the Good Weekend magazine. And really, as I was putting this presentation together, gave a really nice, or a really appropriate, I should say, touch point around the idea of men's health and some of those challenges and how some of the frameworks which we'll talk about today. So again, perhaps in the discussion, I'm sure maybe a bit more pointed in Sean's conversation. Obviously, there's a lot of context-specific outcomes of connection, which we'll talk about today. Just some social connection frameworks to understand, I guess, what we mean at the introductory level as well. On the left-hand side, I speak to a document called Social Connection 101. This, again, is a document freely available via the Swinburne website as well. It's lead authored by Professor Jane Farmer, who's one of my colleagues and really an expert in social connection. And you can see there an understanding of the resource or the exchanges which happen in what we refer to as social connection. So this, in terms of a framework, understands that people give and receive. So there is already an element of reciprocity across this relationship. It understands that there's time and there's emotion and considerable resources put into connection. And as outcomes at the top, when we have quality connections, it does impact our feelings of belongingness, of well-being, and those sorts of aspects. Inside those are, I guess, what Jane refers to as the social connection circles. We all have close relationships. We all have friends, communities that we belong to, and wider community or society as well. So this provides us an initial avenue to say, well, we have a number of different types of connection. Where things get a little bit murky for me, honestly, as I reflect on these sorts of frameworks, is thinking about how do we optimize here? Is it, if there's going to be lots of people who maybe have 5 to 10 people who they really rely on, but they're satisfied and they're getting the social support they need. For others, they may have hundreds of connections, digital connections and online connections that they refer to. And everyone does this in quite a different way. So the way that our work situations, our social situations, if we think about sport, is it e-sport and gaming? Is it playing physical sport or coaching teams? It's a whole range of different ways that we might conceptualize those circles. They're different for everyone, and everyone has obviously nuance towards how they construct and what is right for them. There's not a one size fits all. It's very much, this provides a framework to understand how we might conceptualize connection. On the right-hand side, and borrowing from the 10 to Men and Sean's work here, is, I guess, an understanding of how we think about social connectedness from, I guess, a more subjective point of view, how we might, again, starting to think about measurement. But we know that when we have social support, when we perceive that we're supported, we have what we need in terms of what we call social support. When we have relationships and when we integrate it into our community, they give us this sense of social connectedness. So I show you these things for a number of reasons. It provides a couple of different frameworks to start with. But on the left-hand side, it's arguably a little bit more objective. So we can probably point to the people who we call, if I asked Glenn or I asked someone on the call, who are the people that you'd place in these circles, we'd be able to have a conversation and identify the people and the resources that are being invested there and who those individuals are. We'd be able to talk to those resources. So it's a little bit more objective in nature, but at the same time, it creates these subjective feelings of connectedness, which is, I think, really well represented in the framework of Sean and also some of the other work that we'll refer to today. So in terms of this setting for social connection, we know it's important. We know there are some frameworks and some existing bodies of work that help us conceptualize at an individual level how that happens, the resources and the sorts of people that we might be connected to, and likewise how that results and what sort of things we need to create to feel a sense of belonging or connection. Some of the common questions that we work on across our work is really expanding on really the infrastructure that helps deliver this. And by infrastructure, I'll focus on that in the next section, but we think about all of the different social aspects that form part of what the community delivers or what we interact with. Really anything we do in very simple terms can be represented in that infrastructure. So there are some challenges there about how do we maximize that infrastructure at a community level to create, deliver, or maintain connection. Related to that is how do we create these optimal conditions and what interventions help us to create connection and to enhance connection amongst our communities. And finally, particularly from a research point of view, how do we meaningfully measure connection? And that is one of the things that when we talk about our work with local governments and councils, it's one of the things they really struggle with is we want a measurement for connection. We want to understand how this can be done, how we can measure interventions, how we can put in place individual and community level measurements. So it still remains one of the more difficult aspects and one that I'll close on today. So in terms of infrastructure for social connection, again, we know that infrastructure is a critical component. There's some formal definitions, which are things like the social and essential services that we might interact with. More simply, it's anywhere or anything that brings people together. So that can be both physical, online, or hybrid spaces where we combine aspects of those. And particularly our work here looks at place-based approaches to this. So when we think about place, arguably that is what we mean by community. When we think about the places that we interact with, now here they don't have to be physical places or spaces. They can be virtual or online spaces as well. So the social networking sites, the online communities that we might belong to. But then likewise, place can be everything. It's where we undertake our sport and leisure. It's where the libraries that we visit. It's everything in the community. It's the cafes and commercial places that we go to. It's the arts and sport and things like that that we interact with for entertainment as well. Any of those places really are built as our community. So we do these things. We're encouraged to do these things. And when we are, this arguably is our community. It does exist. So the opportunity, I think, in terms of connection is really making sure that when people are interacting, when they're undertaking activities across their lives and across the community, that we are maximizing the impact of what they're doing, that we are maximizing and putting places into that infrastructure to make sure that connection is happening and that we're maximizing the outcome of that. Because ultimately, and I'll touch on this in a few slides, the connection is the byproduct of these interactions. We don't go out and design so much for connection, but we do things and we have this wonderful byproduct of connection. So we have an existing infrastructure. How do we maximize that infrastructure to create connection? So there's a few frameworks here. I won't talk too much to these, but they are sort of quite prominent in the reports as well. On the left-hand side, it sort of establishes that there's things like spaces and places, there's activities, and there's these really critical people called connectors. We all know them. We've all got example of the people who are just great at organically connecting people, at inviting people, at introducing people, and at getting involved within our community. We all know who they are and things like that as well. So from the infrastructure for social connection, we started with this framework around places and spaces, that there's places, there's activities, there's people. As we looked at the body of work that followed that around some of the social impacts, particularly on the aquatic and leisure industry, again, you'll see the same sort of things arise in that framework. Those four blue areas surrounding community are, again, people, programs, places, and in this case, policy. So again, if we want to maximize, our learning from that project is if we wanted to maximize the social impact that leisure and community centres were having, there were things around people, there were things around programs, there were things around places, and there were things linked to policy that needed to be in place. And in that report, I won't go through this in detail, but it talks about essentially a bronze, silver, and gold standard for each of those elements. So it's an example there in a single specific context, so leisure and aquatic centres, about what organisations should be doing at each level of that framework to maximise, in this case, their social impact. We also looked at what this infrastructure is as well, what this infrastructure was. So again, I won't go into a huge amount of detail here, but in the report, you'll find, for example, in part one, a very descriptive approach to understanding what we mean by social infrastructure. We mapped over 2,600 community assets, and by assets, we mean things like it's everything from playgrounds to libraries to men's sheds and communities. We did this across 4 different local government areas, and we understood what type of connection assets existed and where they were. So on the left-hand side, that sort of colourful map there really gives an understanding for the example of Boroondara, and the 3 other councils are available in the report as well, of where connection hotspots were, of where the distribution and what sort of distribution, what sort of focus area the council had in each case. On the right-hand side, you'll see some other maps there. And what we're able to do there is isolate areas using social data, so publicly available data, to show where, for example, there's a high percentage of people who live alone, or a high percentage of young families, for example. And from there, councils can start to look at, well, what type of connection assets exist, and do we have alignment in those particular areas within our community? So the first stage of the work that we did within this infrastructure for social connection was quite descriptive in nature, but really focused on identifying what these assets were, how they could be classified, and for these 4 councils, where they existed. That also brought to light a number of different types of connection places and spaces. So again, there's about 8 or 16 different cases in the report. But what's key here is that you'll see the first couple of words of each one. There's things like activated places. There's bumping spaces, which is literally just areas that exist in a community where people tend to gather and meet each other and interact. There are integrated places which have multiple different components and aspects or assets for connection, and pro-connection places specific to groups. It may be, it may be for men's health. It may be for multicultural groups. It may be for young people. It may be for older age groups. But essentially, there what we were able to identify is that there were clearly a range of different spaces which existed here, each that were doing connection or providing opportunities for connection, often in very different ways. The second part of that research looked at really talking to people who were delivering programs, so talking to the people about the places and what they were delivering. So we undertook a range of interviews and focus groups, and across that framework, started to look at what are these optimal components for connection. So the idea of this was that when we were guiding the design of program or the design of what councils were doing, what were some of the things that we wanted to see integrated into those programs? So things like bumping and incidental spaces were absolutely critical for these groups. Cross-group interaction was important. So for example, there was a case where a social or community garden would work with a men's shed, a men's work club or work shed, who would produce things like bird boxes or feeding boxes. So we saw this great interaction between groups where there was sort of a supply chain between the two. One group would work to design and produce a product which was used in the community garden, and they would interact around that. Likewise, where multicultural groups or where younger and older age groups were connecting. So we had some great examples over COVID of younger groups of people who would get online and educate or work with older age groups or older people about technology and about safe use of technology. So these opportunities of cross-group interaction, whether it's multi-generational, whether it's people with different interests, whether it's multicultural aspects, were really seen to be really where connection was having diverse interactions was really important. Having a sense of ownership of the space, the importance of those individuals or connectors, integrating digital and hybrid components, particularly in the COVID time when we did this research, was critical. But we were able to identify, and again, they're articulated in the report, sort of 7 or 8 different areas which we saw as optimal components for connection. They can now be built into the way that this sort of that places, spaces, and programs can be designed. So most critically around that, these individuals, these practitioners, yes, they saw social connection as important and linked to positive community outcomes, but consistent was also that social connection was the byproduct. So all of these things, whether it's a community garden, whether it's education and training, whether it's a sport or something, there is a primary activity happening, and that connection is the byproduct. So we have this infrastructure, we have these programs and places and things happening. How do we best design them so that this connection can take place in a rich way? I'll just make one final point on the last point there is that lots of these people that are delivering these community assets are volunteers. And I say this and I make this next comment with the caveat that I mean absolutely no offense, and I think there's some fantastic work going on in the community. But ultimately, a lot of the people delivering these services are so focused on getting the service and the delivery right that they're not thinking about how do we optimize for social connection. It's about how do we get enough people? How do we get enough resources together? How do we make sure that someone's there to unlock the door and get people in? That's a fantastic service that they're providing. But for us, it was about, well, how do we bring in some really simple toolkits, some really simple guidance around, well, let's do X, Y, and Z, and that will, hopefully provide a better basis for people to connect. And there can be some really simple aspects around that. So yes, a lot of people who are delivering these, they are volunteers. They're not trained in social connection, and they don't consider the optimal environment. They're focused on the operational. So we worked with councils to look at, hey, here's 5 or 6 things that we can do to make sure we're maximising the opportunity for connection. Likewise, in leisure centres, as I said, there are about 5 different social outcomes that we can identify in leisure centres. Social connection is one of those. There's a number of case studies on those reports. I won't spend too much on that. But again, what's critical there is, again, the same sorts of frameworks do start to come out. So people, programs, places, and policy, those core aspects are important. And we can, in this context where we're just locked in the leisure and aquatic centre context, we can point to specific things and specific guidance that those organisations can look at to maximise not only social connection, but the wider social impact. And again, that report, as I said, works through a bronze, silver, and gold type standard or set of activities for each of those different levels. Ultimately, in some of our other work, just to touch on a couple of other aspects here, we do know that people who are engaged more do have better connection outcomes. So what we're looking at here, I'll just focus on the middle group of bars there, which has the word connection under it. Essentially, what we've looked at here is a group of, over time, about 5,000 or 6,000 people involved in what's produced this particular graph. But it's a group of people who have no engagement with community, sport, or leisure. People who then in the greys are involved in community only, sport only. And on the right-hand side in that dark black color is what we call complete engagement. So it's people who are focused or interacting somehow with sport and community and leisure and other based facilities. So we do know that as people move into that black area of having deeper levels of connection and involvement, that their connection levels, they report better connection, they report higher well-being, and they report higher senses of belonging and community belonging. So we do know, we have empirical evidence that the more people are doing in this space, they're more likely to have outcomes. What that doesn't answer, though, is how that is happening, and particularly around the infrastructure. What is really happening that's creating this? Doing more and having better outcomes is fantastic, but we need to make sure that we're capturing and informing what is happening that is producing these outcomes within those interactions. Likewise, in a sports setting as well, this is just some borrowed data from a sport here. I won't identify the sport, but we asked in a major survey with them to what extent their involvement with the sport contributes to the following. And one of those things on the right-hand side was your feeling of social connection. About 94% of people said this sport played a role in me feeling connected. And about 46% of those said this sport, being involved in this sport, is a really large or very large component of why I feel connected. So again, we know from a leisure and a sporting perspective that there's some introductory evidence there to guide that these are great things to be involved in. However, there are still a number of gaps in terms of what exactly is happening within that infrastructure. I'll just close with some notes around some of the measurement as well, and then if there are any questions, or we can sort of hand over to Sean. Some notes on the measurement of social connection. It is something that's really critical to our work. I've just given you some really, I guess, descriptive ideas of how we've undertaken some qualitative research and looked at some components. There are some survey components in the data pieces that I just closed that last section with as well, rather close that last section with. We do know that social connection can be considered. It is complex and multifaceted, so there are a number of different dimensions that make us feel connected and that we need to address. It can be both an objective or a subjective means. I can talk to you about what you did on a certain day, about the amount of people that you interacted with, the frequency, the number of people that you can call if you need help, etc. But likewise, we can talk at a more subjective level about things like your psychological safety, the extent that you feel connected, that more subjective perception of your connection. We can measure at both a population level and an individual level. So again, there's some complexities there about how we connect and how we analyze that sort of data. And importantly, we do need to acknowledge that a lot of work has been done in social connection and related constructs. So I will say I've got a PhD student or a master's student at the moment who is working through the measurement of social connection. In the last couple of weeks, we've worked through basically the body of work that's been done, and there's over 500 items. So 500 statements that have been used in surveys that are talking around social connection and related areas. So there's a huge body of work here. But a lot of that work is often conceptualized not from a strength-based perspective, but also incorporates a lot of the loneliness and isolation and those sorts of areas as well. So as I said, a lot of our work is based more about the strength-based or pro-connection aspects. There is considerable inconsistency in a multitude of definitions, and certainly taking a standardized approach, which is what we're working on, will and can have many benefits. When we think about what we measure, one of the emergent frameworks talks about structural, functional, and quality components. Put simply, just the words that follow each of those terms. So in terms of structural, we're talking about the connections we have with others. So that might be, for example, the number and frequency of contacts that we have, the proximity to people that we interact with, our level of integration. So what we do in the community, how many things, how many activities, how many clubs. They're often things that are structural, but also quite objective in nature. In that middle component, the functional, we talk about a sense of connection, purpose, or value. So we'll talk about things like the perceived support system that we have, levels of trust and reciprocity that we have in our lives and with others that we connect with, and our opportunities to be involved in our perceptions of those. And of course, on the right-hand side is the quality aspect as well. So our perception of what the outcomes of those are, or the quality that those connections that we have in our lives provide for us. So there is, in a sense, lots of different ways to look at the measurement of connection. It can be an objective piece around how many people do you know and interact with. It can talk more about, does that network give you what you need in terms of your sense of support, and do you have the people that you can call on when needed, etc. And of course, the quality of those outcomes, which is going to be very different for lots of people. It may be that someone has 10 close connections and perceive themselves to have a very high level of connection. Others may have 10 people in their lives and think have a very different outcome of the perceived quality and the ability to meet their needs. So again, lots of context specific and individual level variables to consider here as well. But ultimately here, if we're looking at connection, our view is that we need to consider each of these different aspects. Each of these need to be measured. They're measured in a different way, and they layer up to this overall idea of social connection. But you should start to see there, I guess, the complexity that can exist in this space. We can measure a whole lot of things. We can measure the number and frequency of people that we interact with. We can measure the structure. So social network analysis can draw either diagrams or statistical analysis about the networks that we have, who we're connected with, who we have ties to. We can measure the level of community integration, what level and volume of activities we undertake, our feelings of social support and belongingness. So even the fact that we're calling them, their feelings of support, their feelings of belongingness, it suggests we're right in that subjective space of what connection might mean. Satisfaction with connection, and of course the outcomes of connection as well. So things like well-being, resilience, different aspects there that might be outcomes of the connection that we're able to create. And we can do those through a number of different ways. We can talk about diagrammatic representation. We can ask people to draw circles of overlap and understand, from that, how people perceive their connection. We can ask them the traditional survey scales and items, so their satisfaction levels, their feelings of social support, etc. We can, of course, observe their interactions and observe what their week or their day or their life looks like. And there is, of course, network and structural data that we can look at around that as well. So again, the measurement space here has got a considerable amount of complexity. So to close up here, again, the what we know is that social connection absolutely has positive outcomes. I've just given you a couple of snapshots of the empirical work there, but there's a whole body of work that supports from a health and a social health point of view, physical and social health, there's considerable positives. We do know that social infrastructure is an important part of that, and it's a really powerful part of how we create the opportunity for connection. The ingredients there, if we talk about the 4 Ps, things like places, people, policy, and programs, within each of those, whether it's at a general level or a specific level, like for our leisure and aquatic centres, there are particular aspects and tools and best practice that can exist in each of those that can help us maximise the infrastructure. Absolutely, measurement is a challenge. It's a challenge of a lot of our partners, and a lot of probably the major question that we talk about is about refining measurement and having access to measurement that can be used in a number of different ways. But empirically, we do know that social connection results from the activities and interaction. So we have good forms of measurement, but we are looking to improve it and test and make sure we've got all of those aspects of connection represented. Our focus for future research is really around refining the measurement. So looking at the pool of items that I presented in a little area, how do we best make that into a tool that can be used by practitioners and academics cohesively to report on measures of change, what works and what doesn't, and good and bad best practice, those sorts of things. We do want to explore how community and sectors can lead and can influence their infrastructure. What sort of things can they be doing with places, people, policies, etc., to maximise social connection and really work within their existing infrastructure to make sure connection is maximised. Our two major projects, I won't talk too much to these, but certainly this is our horizon, essentially is in two main areas here. Though these are two Australian Research Council grants, so they're long 3-year projects. They have some relatively high profile partners in each case. On the left-hand side, activating social connection to address isolation in Australia really looks at vulnerable groups. We're working with 4 local governments there, Red Cross, Anemia, both partners of that work, really looking at co-designing a number of interventions or opportunities, and then using and developing and using measurement that we can test to see the impact of those. So we're in the 2nd year of that project. I'm happy to share any insights on that in the future as well. And on the right-hand side is one that will kick off in the next couple of months. Again, it's a 3-year project, and it's about the social impact and community outcomes just for community sport. So we've focused on this really important part of life in Australia, which is community sport. It's a great, probably example of where my two research areas I've talked about today, sport and leisure and social connection, overlap quite nicely. And we've got 6 national sport organisations there that are supporting us on that journey. And we're going to work with them to understand what is the infrastructure for community sport at the moment, and how do we provide things like toolkits, advice, and work with these groups to, again, really make sure we are maximising the existing infrastructure. So I think the body of what I've spoken about today is, yes, connection is important. We have this great existing infrastructure, but we have opportunities to really focus on that infrastructure, improve it, and maximise social connection. And in both of these projects speak to that. One in more of a looking at vulnerable communities in isolation. The second looking more at a strength-based approach there in terms of community sport that exists. How do we maximise and make sure we're getting not only the health and physical benefits of sport, but these great connection benefits as well. Thank you so much. I realise I've probably gone a couple of minutes over Glenn, but yeah, really happy to probably at the end of the session with a view to hearing from Sean as well. But happy to take questions, and my contact details are there. More than happy to share any of the reports or catch up for a chat at a later time. Thanks.
Oh wow, that was brilliant, Adam. I acknowledge you for your fantastic skill at speaking so quickly and clearly, because you've given us a 90-minute talk there in just under 30 minutes, which is extraordinary.
Unfortunately, that's not the first time I've heard that. It must be a feature. So yeah.
No, it's not. It's not a bad feature. It was the clear part is the important piece in there. So yeah, and clearly also, you covered so much and also scratching the surface, but you've marked out a shape there which has enabled us to see where we could delve deeper in future. I have one key question I want to ask just straight off, just to clarify around social. When you talk about social infrastructure, reflecting back on some of the conversations we've had in the past few days, we've had Shay from Tough Guy Book Club, who runs groups for men in pubs, and he always talks about the third spaces, those spaces outside of the private sector and the public sector. We had Play Australia yesterday, and we're even talking about things like, you know, how putting a bench in a quiet residential street can be a simple prompt for people to sit down and connect. I think about my local community, the most important part is the main beach, which is just sand and water and occasionally a lifesaver. Where does social structure begin and end? You know, because it can be a private cafe, it can be a bench in a street. Well, in your definition, what does it incorporate?
Yeah, and to be honest, it's everything. I think really the place that you know, we can have all the academic definitions in the world to talk to what we might think of infrastructure is, but essentially I revert back to that really practical view of anywhere that brings people together. And a lot of these we are looking to really mix the spaces as best possible. And that means both from a physical space and how do we embed a digital overlay to that. So if it's a community art space, if it's a wall in a local community that kids can come and paint on, if it's the sharing of painted rocks during COVID that kids would hide in the garden and others could find it, tag it and hide it somewhere else. So, you know, whether or not that's merging the physical and the digital space, there's great opportunities there. But I think, yeah, I think we need to consider this as a really open area. One of the things that stands out there is that the space, I mean, a lot of the people who are working in community spaces will say, look, we'd love to change the building that we're in. We'd love to make sure there's a bumping space, that there's a courtyard or there's a lobby or something like that is a really critical part. So a lot of people will look at their space and obviously want to improve it. And I think that's a great opportunity for design and architecture. I've had lots of conversations there about what are the 101 of what needs to be built in there. But the great thing about some of the Aquatic and Leisure Centre is that the facility was almost, you know, agnostic here. It didn't matter if it was a 30 or 40-year-old centre or a brand new multi-million-dollar centre. It's about the people, it's about the programs, and it's about what's happening in that space. And I think that should be encouraging, that this isn't about building, brand new spaces. It's about using what's there, what feels right, and where the community is engaging. So look, I think we think about breaking down the barriers. We want as much connection as we can. We want diverse communities, and that really means taking a very broad view to that idea of infrastructure in place.
Great. Okay. Lots of great comments in the chat box. If you wouldn't mind just having a scoot through those and seeing if there's any you want to respond to as Sean gets going. There's a mention of the importance of having a role as a volunteer in community, in social connection from Alan. There's a comment about the value of building peer relationships, not just connecting an individual to a group from Ross. And one I'll just ask you to pick on briefly now before we move on to Sean is Kim asked, what kind of things are in the toolkit? So the tools that you give to like local councils to help do more than those overworked volunteers are able to do. What types of things would we find in there?
Yeah, and look, it's things like planning time, so planning the arrival time and what happens when people meet for the first time. It's about what we do in weeks 1, 2, and 3. It's about articulating the program design, if it's a 2-week program or if it's an 8-week program. So some touch points there around the physical program design. There's some aspects in there that we guide around people, about the way that they present, about the way they communicate. There's some important aspects there. And what was kind of difficult with the community infrastructure piece with the local governments is what we found is quite difficult to have broad ranging recommendations. So once we step into the aquatic and leisure, you'll see in that report, there's 30 to 40 things that organisations can look and go, look, we do that really well, or hey, we could improve on our policies there. And it's everything about inclusion and diversity. It's about the way that we introduce the start of the class, about aquatic and leisure classes and things like that. So when we get into a more specific context, it's much more easier to do that. I think we've done a really good job with the aquatic and leisure work there. Mm-hmm. And that's one of the challenges here in the new the ARC project around vulnerable communities is a lot of the communities are working on different cohorts. So that again is going to necessitate some different guidance. So there are some things around people, around the places, around the design of programs which we've actively led change in, but they are difficult at the generic level. It's really quite a context specific thing there as well. Okay.
So some broad principles, but no one size fits all. You've really got to make it context specific to have optimum impact.
Correct. Yeah, correct.
Okay, great. Okay, look, we could talk for hours, but we've limited time, and Sean has got equally as much to say. So we'll thank you for now, Adam, and hopefully we will. If anyone's got any questions for Adam, if you want to pop them in the chat box now, and he'll try and answer them directly, or we'll try and pick up at the end if there's time. We'll move now on to that broad, general and technical look at social connection and infrastructure to a specific focus on social connectedness in Australian men, and no one better to do that for us than Dr. Sean Martin from the 10 to Men study at the Australian Institute of Family Studies. Over to you, Sean.
Well, thank you, Glenn. Thank you, Adam. Just checking people can hear me. Great. All right. Well, good morning, everyone. As Glenn mentioned, my name's Sean Martin. I'm the program lead here for the 10 to Men study, our national longitudinal study on male health. I want to begin actually by thanking Glenn and his team at the AMHF for always bringing us together and driving a lot of this energy we see in men's health, and also acknowledging Adam's fantastic presentation. I learned a lot around social connectedness just from that, and I look forward to connecting it at some point in the future. I also want to just start by acknowledging the traditional owners of where I work and live, Adelaide, Gunner Territory. I acknowledge elders, both past, present and emerging, and also any Aboriginal and Torres Strait Islanders that may be joining us today. Okay, so just in terms of the terrain I wanted to cover today, much as it pains me, I'm aware that not everyone is aware of 10 to Men, so I just wanted to start with a quick overview of our study. And given we are in government ourselves here at AFES, just to speak very briefly around how social connection has really kind of emerged quite quickly as a concept in government. And then to talk very briefly about our report, as Glenn mentioned, coming out in December 21. And then to finish up with talking about policy, some of the policy implications and the work we have to do there, and where we intend to take things from this point. Just want to start off with a couple of disclaimers. Firstly, this is mostly not my own work. I've been in this position now for just over a year. And so I want to give due credit to a lot of my colleagues who drove a lot of what we'll present today, and all of which is in our report. Unfortunately, social connectedness is seemingly synonymous with COVID of late. This particular report was generated right in the midst of the pandemic. So I won't be able to speak to any kind of COVID-related data today, although we've just completed our fourth wave of data collection, and we will have plenty of COVID data at that point. But just for today's presentation, no specific COVID-related data. There is a lot of data in this report, and I can't speak to all of it today, otherwise Glenn would kill my mic. But I'd encourage you all to head to our website. The full report is available there, and it covers a vast array of issues related to social connectedness. So as I mentioned, just very briefly to touch on 10 to Men as a study, we are, as I mentioned, a nationwide representative prospective cohort study of Australian boys, young adults and adult men. There was just over 16,000 of those participants at baseline back in 2012 to 14. So it's our 10th year anniversary this year. We're very excited about that, and lots of events planned for this year. We were established initially through the National Male Health Policy in 2010. Again, want to acknowledge Glenn, who did a lot of work around that. I was involved in periphery at that particular time around those conversations, and we receive our marching instructions, I guess, from the current men's health strategy. Broadly, our aim is to serve the evidence base for men's health and men's health policy. And so for us, that involves looking at the key determinants of male health and well-being, addressing key research gaps throughout the life course. We do take predominantly a life course approach, and identifying policy opportunities for improving men's health. As I mentioned before, in December of last year, we completed our fourth wave of data collection. That data is now making its way through to us. We ended up achieving just over 7,000 men, which was around about 90% of our wave 3 net. We're particularly excited about that. It's our best result that we've been able to achieve to date, and has given all of us really lots of data to play around with. We'll be releasing that data publicly later on this year in September. So I really want to make the point of inviting all of you to consider whether or not we can meet some of your programs or your study needs. We've been working increasingly on making it an easier process to become a data user. So again, I'd invite you just to head to our website there, and it's a pretty quick process now to gain access to the data set. We very much are of the view now that this is not our study at all. It is indeed a taxpayer-funded study, and so we're out there trying to disseminate as much of our data and broaden our user base as we can. All right, so just to get to the report itself now, as I mentioned, this was released in late 2021. There's 5 main empirical chapters, really, looking first of all at the level of social connectedness more broadly across Australia, given that we are a nationally representative study, to look at this association between life events and social connectedness and men's perception of their social support. We also looked at this bidirectional association between depression and that feeling of social support. We also want to look at the issue of social connectedness in the context of men who had particular disabilities. And then finally, there was a chapter on community engagement more broadly and its association with social connectedness. As I discussed before, just through the interest of time, I'll just be focusing today on this second chapter. There's a few reasons. I think it's a sort of reasonably accessible chapter. It's particularly relevant to the AMHF events this week. And it is part of an ongoing paper conversion process that we're going through at the moment. Yeah, so as I mentioned today, we sit within government or as a policy, a portfolio agency of government. So one thing I've noticed is really how quickly and how rapidly social connectedness has emerged as a government issue. Began around about 4 or 5 years ago with the UK appointing their own Minister for Loneliness. That was, I'm sure as many of you will recall, met with sort of mixed reviews, but I think it's proven to be quite a judicious appointment. A couple of years later, right in the midst of the COVID pandemic, Japan also appointed their own Minister for Loneliness. That led to a lot of headlines, very bemusing headlines about the two ministers for loneliness eventually coming together in a meeting a couple of years ago. But nevertheless, really only a couple of weeks ago, there was a call from the US Surgeon General identifying loneliness, social connectedness as the next major public health issue. And I think that's really kind of galvanized the field and brought to attention that this is a serious issue that is being taken very seriously by serious governments. So we're seeing a lot of activity now in that space. All right, so just to get to the, I guess, the meat and potatoes of today's discussion, and particularly, as I mentioned, our work around this connection between social life events and particularly men's self-perception of their own social support. Just to walk you through some of the thinking on this chapter. Firstly, it's known through the literature that these social life events are one of the largest and most consistent drivers of social connectedness, and they have a particularly both positive and negative effect on the dynamics of people's social networks. They can alter, obviously, people's perception of their social support, and particularly during important life transitions. So as boys emerge into adolescence, as men disengage from the workforce and enter retirement, these additional social life events can have quite impactful, or can be quite impactful. What's less clear, particularly in relation to men, is which of these social life events, and particularly when, impact men's perception of their social support throughout their life course. And this is obviously important, particularly as it relates to mental health outcomes. So our aims very quickly were to, first of all, describe the nature and prevalence of these social life events using our representative prospective cohort, and then specifically to look at the impact of the social life events on men's perception of their social support. I won't delve too much into the methodology just as yet, but just to point out that we did use some validated measures when we looked at both our outcome and our exposure, or our main variable of interest. Yeah, as it's discussed, we were interested in really a range of social life events. So social life events are those that are particularly known to impact either a man's social or a person's social environment and or their relationships. There's a range of these. We use an adapted version of the Hilda measure and focus particularly on 15 events. They range from the very serious death of a partner or a spouse, death of a child, to I guess the more benign events, but nevertheless still impactful. So moving house, and transitioning into retirement, or having difficulty finding a job. So if we just look at those, the distribution, I guess, of those social life events in and of themselves, you can see here that the majority of men from our sample had at least one social life event in the previous year. And they're particularly more common in younger men. So you can see here around 2/3 of our young guys, our 18 to 24-year-olds, had at least one social life event in the preceding 12 months. There is also co-occurrence of a lot of these events. Again, they tend to be particularly more common in younger men. As you can see, around 41% of the 18 to 24-year-olds compared to 22% of our 50 to 60-year-olds had 2 or more social life events in the preceding year. In terms of these individual social life events, you can see the most common one was moving house, followed quickly by difficulty finding a job, and unfortunately, across really the different age groups, a death of a family member. I guess reassuringly, least common was loss of a child, infidelity, or transition into retirement. This report mostly focused on our first 2 waves of data. At that point, our older guys were 60, so obviously that's a point at which most people will start, but the majority won't have entered into retirement, and our data reflects that. At 10 to Men, most of our research tends to take this life course approach, so we were particularly interested in how these social life events differed across the different age groups. As you can see here, there are some, such as difficulty finding a job, that really are consistent across the various age groups. So just on the left here, we have, I guess, the top 4 social life events that occurred for each of the respective age groups. And so difficulty finding a job was one that was consistently found through all age groups. Although, again, we've got to make the point that it was certainly more common amongst younger men when we're talking about difficulty finding a job compared to older men. And also death of a family member for men over 25 was a consistent life event across those age groups. There were some differential life events. So, for instance, if we look again at our older guys, around a third of those had either experienced death of a family member or a family member leaving home or some serious family conflict. We realize, obviously, that life doesn't occur in a bubble. Life can come at you fast, very quickly. And so we're interested particularly around the co-occurrence of these social life events. And here you can see on the left, these, I guess, are the most common pairings across, again, the various age groups that we studied. And again, well over a quarter of men had at least 2 or more significant social life events in the past year. And the most common pairing was really, this kind of related construct, but slightly different, of losing your job or a difficulty in finding work. And that was, again, more common in younger men compared to older men. And again, we start to see as men age that there are these more relationship-based social life events that are the most common occurring events. Now, I realize that not all of you will be data nerds such as myself, so just to talk through our approaches here that we most often sort of take with 10 to Men, and that's using what we call a multivariable or multi-adjusted models. This allows us to give us, I guess, a more precise estimate of the effect between any given variable and an outcome. So in this case, we're looking at the effect of these social life events on men's perception of their own social support. And this is because, obviously, there are instances where some variables may be related to both this exposure or this particular variable that we're interested in and the outcome. So for an example, it's known that education or your education status can affect the connection between these life events. So for instance, losing a job, but it can equally also affect your perception of your perceived report. So to get a more accurate estimate, we adjust for those given factors. What we find when we do that is that we can see that once we've adjusted for these various factors like your social demographic status, your income levels, etc., that there really is a consistent effect of these social life events, particularly difficulty finding a job, on your perception of your social support. Around about an 8% decrement is what we consistently see throughout the life course. There are also some effects that are specific to younger men, obviously, particularly those that are emerging from adolescence. Leaving home for the first time is quite a significant event, and that can interfere or interrupt or disrupt their perception of life support as they leave the family home and look to make connections themselves. Likewise, with older men, we see this reflected in the literature. It really is, particularly for men, disruption to those family dynamics that can interfere with that perception of self-support or social support. And obviously that can leave particularly older men prone to poorer mental health outcomes.
Sean,
Yeah.
could I just, for those of us who aren't data nerds, which will be a few of us.
Sure.
Sure. Could you just take another few seconds to explain what was meant by, you know, the when you said the 8%, what does that mean to a layperson? So
no, sure, absolutely. So we used this particular self-report scale that ranged from 0 to 100. So if you have a look at these numbers here, and I accept that this is going to test everyone's subscription to Specsavers, but basically we have here these negative numbers. The asterisk means that there's significant findings. So after doing all these adjustments, these relationships still hold. And what you see is basically a 7-point decrease in this particular scale that we used. And because it is ranged from 0 to 100, then that maps to a percentage decrease in men's self-perception of their own support. So,
right. So to see if I've got this then.
Yep.
So a man aged 18 to 25, and when you made all the other adjustments to what could have affected it, if he's going through the experience of having difficulty finding a job, it also has, on average, a 7% negative impact on his sense of having good social support.
That is exactly it. And then, you know, we see that effect really consistently through the other age groups as well, you know, peaking at around about 9%, but it's roughly at that 8 to 9% decrement for men across the life course, or at least the 18 to 60-year-olds that we studied, having this, you know, quite significant and sustained effect. And that's what the literature tends to suggest outside of this analysis, this sustained effect on their perception of their social support. And that's obviously very important when you get into mental health outcomes, because this perception of social support is a very important buffer to potentially heading down some poorer mental health outcomes, given a range of different factors.
Thanks for that, Sean. Appreciate it.
Not at all. I do seem to be missing a slide here. That was essentially just looking at this effect of co-occurring social life events. I'll give you the skinny on that. Essentially that the co-occurrence of social life events didn't add any additional level or decrease to this perception of social life support. Again, that tends to match with what's seen in the literature, whether they're social life events or other adverse life events, that these initial insults or these initial events can be enough to trigger a decrease in either self-perceived social support or indeed negative health outcomes. So just to finish off with some take-home messages, as we said, we wanted to have a look at how these experiences were for men across the country, and we were able to say that more than half of the men had at least one social life event over the preceding year, and that these are indeed more common in younger men. Overall, as we had just seen, it's particularly a difficulty in finding a job that led to the biggest decrease in men's perception of their own social support. But there are these differential effects, particularly with employment-related events with younger men. And for older men, as we've spoken about, it's really these relationship dynamics that are most impactful for men's perception of their own social support and their own mental well-being. As I mentioned at the start, at AIFS, we're a portfolio agency of government. The 10 to Men is at least supposed to be a policy-facing study. So the policy implications of our work is something that we are focused on. Don't always do particularly well, but we will be increasing our focus in that area. In terms of this particular chapter's policy implications, one thing, and this is not really covered all that well or all that extensively in chapter 2, it was more covered elsewhere. But one thing we've been able to demonstrate is that through increasing a participant's community participation, that can really act as a buffer for some of these life events, induced a decrease in social connectedness, and obviously later on can act as a buffer for poor mental health outcomes. And that's something we see consistently, again, across the life course. Really, as Adam sort of touched on too, a lot of this energy, particularly from a policy space, has been traditionally focused in older men. And we're starting to see there's emerging programs, emerging policies that are particularly focused in younger men, given that they do have their own bespoke issues that need to be addressed. So we hope to be continuing our focus in that area as well. Again, this is more covered in other chapters of this particular report, but it is really true that older men particularly remain vulnerable to social disconnection. And there are obviously a range of existing models that we need to celebrate as a men's health sector. I'm thinking particularly of men's sheds and others, but from a policy perspective, it's pleasing at least to see that there's an ongoing commitment to sustaining and expanding those. I guess some of that expansion work is around really looking at more targeted interventions, given that we as men are not a homogenous mob. Men are varied and complex, just as women are, and so it's great to see that there are some tailored interventions that are looking at a whole range of men and men's groups. So I know that there's a lot of work that's, for instance, being done with veterans, with migrant communities, with Aboriginal and Torres Strait Islanders, and many more. It's nice to see that work is heading in that direction. And obviously from 10 to Men's perspective, a large prospective cohort study will hopefully be contributing in that space. I guess one other emerging policy issue is the role of technology, particularly post-COVID. Obviously, we're all forced through this great natural experiment. One thing that the literature seems to be grappling with at the moment is whether or not you can sustain that quality of relationship and social support as compared to more sort of traditional face-to-face measures. But the jury, at least as I've seen it, is still out on that. Another kind of emerging policy issue is really the role of workplaces as facilitators of social connectedness. As our own data shows, the absence of being involved in the workplace can have quite an impactful insult on people's perception of their social support. And so as a result of that, there's really been this increased effort and programs around using the workplace to establish connections that exist outside of the workplace. I was lucky enough a couple of years ago to be in Boston and worked very briefly with a group who were working on indeed exactly those sorts of programs, the work and wellbeing initiative, but there are countless others now, which is again great to see. In terms of where we go as a study from here, as I mentioned right at the top, we now have a fourth wave of longitudinal data that's allowing us to unravel a whole range of complex issues, and particularly those around life events and social connectedness and men's well-being, and obviously other issues. It's quite an exciting time for us now, because really, whilst this report has two waves of data, that doesn't really allow you to do a lot of longitudinal modelling, and that's really been the promise of this study all the way along, dating back to those initial discussions 10 or so years ago. As I mentioned, we finally now have some COVID data. We'll be looking at how that has impacted men's social connectedness and how that will continue to impact or rebound men's social connectedness. We also, as I touched on before, want to extend these initial findings into other priority populations. That's based on the work that's identified in the National Men's Health Strategy. We're also starting to work with a small range of NGOs and startups to help inform their interventions. And I guess the final point, not to get to Uncle Sam, is that we really want to engage more broadly with the men's health sector and other related sectors. My firm view is that we need to do a better job of doing that as 10 to Men. There are a lot of great activities out there. There's a lot of expertise out there that we just weren't engaging with previously, and we want to do a better job of that. And as I said at the top, really want to encourage you to reach out to us, and we'll try to help as many of you as we possibly can. So just finish. I want to again thank AMHF for putting all of this week's activities together, but for a long period of time, bringing us all together to talk all things men's health. Of course, always want to thank our participants and their families, without whom we wouldn't have much of a study to work with, and our various other partners as well. And thank you all for your attention today. With that, I'll throw it back to Glenn.
Great, thanks, Sean. You've again, as with Adam, covered a great deal of information, and also left us wanting to find out more about those other areas you didn't cover. Really interesting. I just want to pull out, the focus on work throughout this conversation. We have touched upon like men's role within the connections they have, and men's sense of identity, and the examples that are often given is men's identity linked to their work role, their role within family as breadwinner, and their role within family as father, and how vulnerable men can become when one or more of those is lost. So really interesting to see the piece around that connection to struggling to find work and sense of social support. Also, you mentioned conflict with family members. Just to clarify a point for me, but also to ask a question from the floor. So firstly, does that include does family member include your partner? So does that include conflict with partner and family breakdown? And Chris was asking if you could shed any light or any thoughts on why that seems to become more of an issue when men hit this sort of 35 and over mark.
Yeah, look, it's a great question, Glenn. I mean, I think to tackle the latter question first, what the literature does tend to suggest, is particularly for older men, is that they tend to be, as they age, more dependent on their spouse for their social network. If there are these family kind of conflicts, and that can include spousal conflicts, then particularly for older men, then they experience quite rapidly this loss of social connectedness. And then are more prone to some of these outcomes. So that's particularly something we see in the older age groups. And yes, to take the earlier question, those family conflicts can indeed include spousal conflicts as well. Yeah, look, I mean, anyone who's followed longitudinal studies for a while will speak to the problems that we have with some of these measures. They don't always capture everything that you would like to capture. One thing that we are looking to do now as a study is use qualitative data more, so actually sort of get into where we are sensing signals, to get into these issues with a select group of men, just to be able to talk through their experiences there, and that will indeed kind of inform how we shape, I guess, the quantitative arm of our study and the work that we do carry forward.
Right. Look, we're rapidly charging towards 10:45, so I just want to check whether you both have another 5 minutes or whether you have a hard exit. Yep, great. Yep. So thank you. So question from Noah. Sean is just asked if you can shed any light on link between depression, and I'm going to add in other mental health conditions, and self-reported sense of connection. Yeah,
absolutely. There certainly is a link. It is kind of, I guess, a bit of a chicken and an egg question. And again, that's where longitudinal studies can help. But to cut to the chase, there is a link. So men with depression will tend to withdraw from some of their social networks. So there's an effect there. But equally, those who experience through perhaps other mechanisms a loss of connection are more likely to experience depression. So the effect based on our study is more the former. So that loss of social connectedness is a greater effect on depression rather than vice versa. But nevertheless, it doesn't discount the effect of one or on the other. So there's a great academic paper that's just been published by our group this year that gets into some of those issues, not to get too wrapped around the axle a little bit, but, it uses this kind of causal modeling because obviously, Glenn, as you well know, and many others do, mental health is a very complex Gordian knot, and trying to untangle all of those different inputs is very difficult, and it's one of the things that longitudinal studies should be doing. So we've taken that approach to take all those inputs and adjust for those, and it shows quite clearly that there is a connection that swings both ways. I popped up a link just recently to that report. I think it's chapter 3 that delves into sort of those issues. So Noah, if you're interested, have a look at that report, and it'll cover some of those details there.
Great answer, Sean. Not just a chicken and an egg, many chickens, many eggs, and quite a few omelets as well.
Exactly right.
A question then to both of you. I'm really interested to sort of get any thoughts you have on social isolation versus social connection. One of the narratives we're hearing is just even identifying people as lonely or socially isolated is stigmatizing. We certainly see any projects we see that do focus on social isolation tend to reach almost entirely women and very few men. And some reflections from people working in that space has been that that's the stigmatizing piece is even more stigmatizing for men than women because they won't identify as lonely. Men won't subjectively identify as lonely as readily as women, even though objectively they are socially isolated. But if we only focus on the strengths and the social connection, as someone flagged up earlier in the week, really lonely, isolated blokes won't want to connect to groups, and that won't work for them. All this positive mateship, social connection stuff may even alienate them further. So, any thoughts you have in the short time we have left on that tension between focusing on isolation and connection, or loneliness and connection?
Well, I'll kick off. Just to acknowledge that indeed is an issue, that there are many men who quite honestly prefer to be isolated. They're very happy. Their levels of both physical and mental health track with the rest of their kind of cohort. So, I think the approach here is to not force everyone into a situation where they're not necessarily wanting to be. But it is sort of just to obviously acknowledge that there are clear links here, and to progress the field in a way that sort of identifies, particularly for us, key pockets of men where there are these sustained decreases in mental health. But absolutely, there are lots of lone wolves out there who very much enjoy their own company, and more power to them. The approach behind this is not to sort of force them into support groups or into kind of programs that they don't necessarily want to be a part of. I guess it's just to focus on subgroups of men for whom this is a real issue, so that we can sort of help to try to identify these more targeted interventions, which seems to be where the space is going now. It's trying to find the right intervention for the right group of men at the right time, and that's where the research activity is focused. But there will always be groups of men and women who just prefer to go about their own business, and as I say, more power to them.
Yeah, great, and important to notice. I acknowledge something that flagged up in either Adam's work or his colleagues' work, that not all social connections are necessarily positive. There can be negative social connections as well. Adam, your thoughts?
Yeah, look, the tension certainly exists. I'd sort of echo what Sean and the way that you presented as well, Glenn. I think one of the things around our focus on the strengths-based or the pro connection is that we can create an infrastructure that I hope can gather what is needed and what can develop in the space. So the other point I'd make is around some of the measurement aspects as well. And I think it's one of the complexities around social connection measurement. When you look at the main measure that's been used for social connection, it has a lot of loneliness wording items in it. There is, conceptually, we probably put the two together a little more closely than we should. And I think there is an opportunity really to unpack that they are absolutely related, absolutely interrelated, and they create a tension. But for me, and I think for to maximize the impact of the work, we need to, perhaps not 100%, but we need to certainly have a clear and dominant focus, I think, on pro connection and creating those opportunities.
Right. Okay, look, thanks for the extra time you've given. Thanks, you've just provided so much insight and so much food for thought in just under an hour and a half. Thank you for everyone who's actually come along and participated, asked questions in the chat box. We will continue this conversation, and at some point we will try and condense all the key parts out of these conversations into some kind of report and recommendations on social connection and men's health.